Hello everybody and welcome back to my channel. Today we are going to discuss something that is hot in media in the news right now, and it is concerning a nurse from Vanderbilt Hospital. Little backstory about what's going on with her. She is a nurse, and in December of 2017 she made a very simple error, and that simple error caused the death of her patient, Charlene Murphy. So a little bit of what was going on that day. Rhonda was in I assume the neuro ICU because the patient was recovering from a subdural hematoma and she was improving. During her hospital stay, the patient was ordered a full body scan. I'm not sure if that was a CT or a PET scan. I didn't really see that in the documentation anywhere. The type of test doesn't matter. The point is that the patient expressed that she was anxious about being in a confined space, that she's claustrophobic. So this is how I expected this, little exchange went. She expresses to the nurse how she feels claustrophobic and she's afraid of being in the scanner for a very long time. The nurse will turn around and go to the doctor and say, she's worried about being in there. Can she have something to calm her while she's down there? So the doctor says, of course, that's reasonable. I'll give her some Versed. Puts in the orders. Rhonda, the nurse, goes to pull that out of they just call it a medication cabinet. If you work in healthcare, you probably know it as a Pyxis. So she goes to pull out a Pyxis and it's not coming up. In my experience, when it's not coming up in the Pyxis yet, the pharmacy hasn't verified it yet. That's just how my hospital safeguards in that way. But in her situation, they could have, CT could have been calling like, we're ready, can she come down? Like, we're coming to get her, so you gotta hurry up because they're not gonna wait for you. So she's probably in a bit of a rush, so she did an override. So instead of typing the generic name for Versed, which starts with an M, she types just VE and takes the first thing that pops up. And unfortunately, instead of it being Versed, it was vecuronium, which is a paralytic agent. So Versed is a benzodiazepine used as a anti-anxiety. Also, medications that are in that class are Xanax and Valium. So it's not the same as a paralytic agent such as vecuronium. So she overrides it, pulls it. It's a powder, so it needs reconstituted, so you get a flush and do that, or however her policy is, and gives it to the patient. So my understanding is that the patient was having the test. She wasn't being properly monitored as far as like on a telepack or being visualized to make sure she's still breathing. After the test was done, about 30 minutes, they realized that she was not breathing. CPR was initiated, she was intubated, moved to the ICU, and a few days later the family chose to withdraw care. So let's first talk about how this happened, like what the nurse missed. So whenever I give any medications, I'm thinking about the 5 rights, as right medication, right patient, right route, right time, all that. So she had maybe 4 of the 5 rights correct, but the right medication was not correct. So if she had gone through that, she would have known. But when you're busy, you don't have time to say, okay, this and this and this and this, and spend 10 minutes giving one medication. You'll never get done. You have to find a way to speed up the process. How I do that at my hospital and on my floor is I have a scanner. Scan the patient's wristband. Ask the patient to tell me their name and birthday if they're able. Compare it with what I have in the chart. So in my MAR, it'll say scanned, and I'll know that I've scanned the proper patient, then therefore scan the medication, then I will know that I have the proper medication. And in that, it'll tell me how to give it and all that. So she perhaps was in a rush, and maybe they could have been waiting outside the door like, TikTok, we have to go to the scan, we're busy too. And so instead of scanning, she just hurried up and gave it. She's like, okay, she's good, she can go have her test. I gotta worry about my other patients now. So it's very easy to see how this could have happened. There's also a bag that the paralytic agent comes in that says paralytic agent on it. She didn't see that. Looking back, 2020 vision, you could say, how could she not have seen that? But when you're in a rush, you're like, doing stuff. I give heparin shots a lot, which is just to prevent blood clots. It's not any long-term treatment. But right on every time I have to open one, I have to peel off a tape thing that says not for IV HEPLOC. Every single time. But after so long, I peel it off. I don't even read it anymore. Just peel it, because I know what it says, but I just peel it and go. Like, I don't read it. So perhaps this was something that she's just seen so much that she's just like, okay, move on. I gotta keep going. So what did the hospital do wrong? My very first question is, why is a paralytic in the Pyxis and just able to be pulled out like that? That confuses me to no end. Why would that be available if you needed it? That's something that should not be readily available like that, especially since it's such a strong medication. It's not just like a Tylenol. That's a serious med. You can't just be pulling that out whenever you want. So that makes me question literally everything. But there's also some things in the news about how Vanderbilt does not have good safety systems in place, and they don't have things that keep patients and keep nurses safe. Because if you can very easily make a mistake, now you're in trouble. Now you're in her shoes, where she's facing criminal charges over a very easily made mistake. But a lot of the safety protocols that she should have done, a lot of the safety protocols that should have been in place before she even got there, were not there and were not done. And it's a perfect storm. Some people might have heard of the Swiss cheese model, where all the little holes line up, and it's a perfect straight through all the little holes to a med error, where there's safeguard, but all the little holes in all those safeguards perfectly lined up, Swiss cheese model, and this happened. So this happened in December of 2017, and throughout 2018 they were being investigated. The hospitals were investigated to see if they were taking steps to keep patients safe, because that's the most important thing, is keeping patients safe. And then the second most important thing, in my opinion, is keeping staff safe. Whether it's physically safe, whether it's professionally safe, however you want to slice it, staff safety is number 2, patient safety is number 1. So they were found that they were not putting those improvements in place. So the Medicare and Medicaid reimbursement was threatened, and that's a good chunk of their revenue, and if a hospital loses that, they're not likely to survive. So after this happened, they were like, well, we're cooperating fully, and put out this ridiculous press statement and everything else, and they marched the nurse right out and fired her, just like that. We made personnel changes. Okay. So February 4th of 2019, she was charged with reckless homicide. And this is the most insane thing that I have heard today. How can you charge a nurse with reckless homicide when you made all the right circumstances for her to make that human error? It's a human error. Was she being malicious? Did she have intent? Was she being negligent? These charges are completely outrageous. And I want to say to the nurse that I support her 1,000%, and she should not be in the situation. And Vanderbilt is using her as a scapegoat to try to cover their ass, to try to save their Medicare reimbursement and save their hospital. And it's unacceptable. This should have been taken care of when it happened, and it should have not even happened because it should have been taken care of before then. So what is a just culture? Just culture, in simple terms, is doing the right thing by all the people involved. And in healthcare, it's promoting improvements over punishment. And this is from the American American Nursing Association. It's improving patient safety, reducing errors, and instead of punishing the nurse for every little thing that she does. Because I tell you, things happen. I'm sorry. It doesn't matter if you've been a nurse for 2 days or 20 years. Things happen. She was a nurse. She's been a nurse for over 20 years. She still made a mistake. It's not just because you have so much experience that you can never make mistakes anymore. This kind of stuff happens, which is why the safeguards need to be in place before it happens, not after. So what happens when there is no just culture? What happens when punishment is favored over system improvement? Well, just in any situation, the person who made the error is going to be afraid to report it. She could have very, very easily hidden the evidence. And I don't say that she should have. I don't think she should have, and I'm glad she didn't, because that's not right, and that's not going to help future patients. But she could have tossed those two things and said, I gave her Versed, I don't know what happened. And that could have been the end of it, and she wouldn't be in the situation, but she would know that in her mind, what she did. She would know that she gave the wrong medication and lied about it. So when you don't have a just culture, when you make a small error and you know that something bad is going to come at you because of this small error, you might go to some lengths to save your job, to save your career, your livelihood, your life. You could be in a situation where she has a homicide charge on her, and she's never going to work again as a nurse unless this gets handled and wiped from her record, which it doesn't deserve to be there in the first place. So before we get too ahead of ourselves, let's not forget about the patient, because she was the one who ultimately suffered the most because she is no longer with us. So vecuronium is a paralytic agent. So this is a muscle paralytic. When you give a paralytic, the patient needs to also be sedated and have a artificial airway. Because when you have just a paralytic alone, it paralyzes all of your muscles. You can't move, you can't blink, you can't speak. It also paralyzes your diaphragm. You can't breathe. So the patient would have felt this coming on and maybe thought at first, okay, I'm feeling more relaxed. And then she would have felt, it's too much. I can't speak anymore. I can't move my fingers. I can't tell them something's wrong. Do they know that I'm not okay? And she would have felt that fear, and she would have heard everything. She would have heard the text saying, okay, she's ready. Or she would have heard them saying, okay, we're going to do another one. No one knew except for her that she was dying. And at some point, she no longer was breathing enough to supply enough oxygen to her brain. She then went into cardiac arrest, and all that happened, and now she's deceased. That is quite possibly the most horrific way to die. Knowing that the people who can help you are right there and you can't tell them, that is horrific. So let's not forget that the patient suffered greatly. And whenever in my specialty is med-surg, we don't use this kind of medications, but while I was in nursing school, they were discussed, and it should be baseline rule, you never give a paralytic without adequate sedation and an airway, because if you don't have the patient sedated, they're just on a paralytic with an artificial airway, they can feel everything, they can hear everything, and they can't do anything about it. That is horrific. You are trapped inside your own mind, and you can't call for help. And there have been instances where patients have had a paralytic and not a sedative, and when they came out, they have serious post-traumatic stress from that incident, and that is horrific. You cannot do that to people. So why Vecuronium was able to be pulled out of the Pyxis with nothing else stopping you, that's unacceptable. There should be no reason that should be available like that. The patient's family has put out a statement that she would not want the nurse to be charged, and she would not want the nurse's life to be ruined, and that she would forgive the nurse if she was alive, because she was apparently a very compassionate woman and a very kind-hearted woman who would not want multiple lives to be ruined over a simple mistake. So Rhonda was in so the nurse was indicted on reckless homicide, and we will just have to wait and see what happens. There has been an outpouring of support for her, and there has been some strong criticisms to Vanderbilt on how this could have possibly happened, because this is unacceptable. Should she have been fired? I don't think so, because I can very easily see myself doing that. You're in the Pyxis, you gotta go, you rush and hit remove, and you pull it and you run. And then when you get there, you realize, oh shit, I have something wrong. I mean, I can tell you that this isn't nearly as severe, but I was rushing and I pulled 2 instead of 1 because they were still attached together, 2 pills instead of 1. When I go to scan the patient and then scan the medications, I realize, oh, I have 2 instead of when I only need 1, which is why you always scan. And I know that it's so easy to override because you are so busy and everyone's counting on you and everyone's demanding your attention right now. And this person has to pee and this person wants water and this person's in pain and everything is just coming at you, besides the ones that are mean to you and abuse you and yell at you. And that's a whole another topic that we're not going to get into. The nurse life is not just waltz in, do your job, and waltz back out. It is hard work, and this is not discrediting any other person's job that's not hard, which is why we take a nursing oath to always put the patient's safety first. Let me know what you think down below. If there's any nurses out there, give me some examples of how you have caught yourself from making a bad mistake, or if you've seen things happen, or how your hospital puts things in place to keep you and the patient safe. And thank you so much for watching. I really appreciate it. If you like this video, you can check out my channel. There's a few more that you might be interested in, and I will see you next time.